Assalamu alaikum, everyone who is out there listening, and to our guest first and foremost. We've got Bilal Zia here with us, all the way from Canada, if I'm right.
That's right. Walaikum assalam. How you doing?
Alhamdulillah, all good. Just a little disclaimer before we continue with the talk. For anyone out there listening, this will be slightly sensitive information. We will be discussing mental health, a little bit about suicide as well. So just a little bit of background before we continue for anyone out there that's going to be listening. Today we have with us Bilal Zia. If you can introduce yourself, who you are, where you come from, and what do you do?
Yeah, thanks so much, Ismail. So my name is Bilal. I'm a PhD candidate at the University of Manitoba, and I'm also a research intern at the Stanford Muslim and Mental Health Lab. So I'm actually close to finishing my studies to become a psychologist, and right now I do some psychotherapy with the Muslim community and sort of the general public as well, in sort of the greater Toronto area. I mentioned the city, but I think you probably wouldn't know over in the UK which city I'm talking about.
You mentioned Canada, and that's as far as we go, to be honest.
Yeah, I was hoping Toronto might give you some sense of.
One, yeah. We always get that one.
Yeah, it's the only place that people recognize.
That with UK, Manchester, London. That's as far as I'm sure your knowledge encompasses that, but surpasses that. Sorry.
Yeah. for sure. So my research interest actually focuses specifically on Muslim mental health. And I sort of have a couple of different streams of research. The first one focuses on sort of challenging the barriers that Muslims face towards seeking mental health services. And then the other stream of research that I have has to do with suicide prevention, intervention, and postvention when it comes to specifically the Muslim community, but also more broadly when it comes to religion and how it relates to suicide prevention.
What was your path into that? What made you get first of all, what made you want to get into psychology? But second of all, the Muslim side of things to relate to them. What was your journey to that?
Yeah, that's a really good question. I think there has been sort of in my own life and sort of the influence of my parents, as well as the influence of sort of the scholars and the role models that I grew up around. There has always been this impetus to be of service to other people as best as you can. And generally our families tend to think of that as, go into medicine or go into some form of other profession like scholarship like that. And one of the things that I noticed growing up, I was born in Canada, and as I grew up, the sort of proliferation of Muslims in Canada started. So by the time I was in my high school years, the Muslim population had just flourished out of nowhere. I think it grew by over 100% every decade since I've been born. And what I noticed is that there were these same issues that people have been talking about for the last decade or so with regard to mental health. People were sad and people were overwhelmed and they had trouble adjusting to the cultures. But there were very few people in our community who knew how to address that or who were trained to specifically address that. People would go to imams and things like that. But, a lot of these issues went beyond what an imam would maybe be able to help you with, things that were actually really serious mental health concerns. So my path into that was sort of looking at what it is that makes people do what we do, why it is that we follow the behaviors that we follow, which is sort of the field of psychology in general. And then from there, I figured, how can I be best be of service to folks who are maybe not acting in ways either in accordance to Islam or their beliefs, or just conducive to living well. So people that are suffering with emotional problems or behavioral problems. And then the path sort of opened itself up as going into the field of clinical psychology.
Just to remove any misconception from people, I mean, I have these questions myself when I see people or counselors and such, or psychologists and stuff like that. I know this is a very broad question, it's quite early on, but how hard is it to take the burden of somebody else's problems upon yourself, like in a daily setting, if that makes sense? Or is that not how you see it?
Yeah, it's partly it can be like that. There are obviously cases where someone has gone through some really difficult times, and when you see that, it really breaks your heart. Generally, though, I tend to focus more on the improvement. So, alhamdulillah, when people come to a trained professional, we're sort of able to find ways for them to reconcile these tragedies that they've gone through, or reconcile the real struggles that they've gone to. So I've always seen therapy more as a hopeful endeavor than it is sort of a tragic one. And, of course, the reason for that is I get to follow the progression of someone. I usually start seeing someone day one, and they're maybe not doing so well. They're emotionally really distressed or overwhelmed. And then you get to watch the progression of them coming in every week, an hour a week, and seeing their lives really improve. So for me, that's really, it's really fascinating and really just a rewarding career in and of itself to see that actually
Feel
happen
good
right away.
factor, isn't it, on a daily basis? I guess.
Exactly. Exactly.
So just to kickstart off basically the why we're doing this podcast and stuff, what is mental health for the layperson like myself, and like, is there a difference between mental health and mental well-being?
Yeah, I mean, those terms I use them fairly interchangeably. I'm sure if you go into the science of it all, there's probably, the semantics are there that you can sort of parse it out, and there may be some specific differences. But generally, when I think of mental health, what comes to mind, right? Well, there's a couple of different factors, right? So mental health, typically when I think of it, has to do with your emotions, right? That's why I tend to think of mental health problems as emotional problems. But the reality is emotions aren't standalones by themselves, right? It's the reason why if someone is really sad, you can't just tell them stop being sad and then they stop being sad. It doesn't work that way. Mental health problems are sort of related to emotions, and they encompass emotions, but they also encompass styles of thinking as well as styles of acting or behaving. So those are sort of the three prongs to mental health: your emotions, your behaviors, and your thoughts. And a mental health problem can really stem from any one of those areas. It could be that someone is sort of engaging in behaviors that are unhealthy. That could, include substance use. It could, include, excessive sleep or excessive eating, things like that. On the flip side, it could be something related to the way that they think. Someone who's really unable to stop worrying. Someone who's constantly thinking, should I have done this instead, or should I have done that instead? Someone who has maybe obsessive compulsive thoughts, who literally cannot get a thought out of their head unless they go through a sort of a system of routines that they've set up for themselves. And on the flip side, it could be very emotional. So someone who is deeply sad all the time, someone who's angry all the time, someone who sort of has raw emotions all the time. And what you'll find is typically, in fact, it's unlikely, and I've never come across it, that it's only one of these areas that's affected. It's typically all three of these areas in sort of all together, that constitute a person's mental health and where things go wrong.
For like on a daily basis for us, we hear the terms when I think of mental health, the first two things that come into your mind as a student as well are depression and anxiety. The two things you hear constantly, especially in a cultural setting and a student setting, just on a daily basis. What are these two terms, and how can we spot these symptoms for them in others and ourselves as well?
Yeah. Depression and anxiety are both, so those are the most common mental health problems. Depression, they affect, in the UK, I can't say the numbers off the top of my head, but I think would probably be a fair estimate to say about 25% of people will face some form of psychological problem in their life. So that's 1 in 4 will face some problems. So basically, if you yourself haven't faced depression or anxiety, or not facing depression or anxiety, there's a substantial chance that you may develop some of these emotional difficulties. And it's very likely that someone even if you don't develop, someone will develop some of these emotional difficulties. As for describing them, each of them have sort of specialized diagnostic criteria, right? Like it's the same way you would diagnose, a broken arm. You can look at it and say that looks broken, but you got to go to the doctor. And the doctor is going to, go through it and check it out for you and give you a final diagnosis. In the same way you would go to a psychologist or a psychiatrist, and they would sort of go through the criteria with you, figure out where the problems are starting and things like that. And then they would offer you the diagnosis as well. But that being said, we can sort of get into some of the general principles of what you might see. So with depression, we're tending to look at, people tend to think of it as sadness, which is in part true, but depression can be more like a deflated. So think of the actual term depression to mean, being depressed or being compressed or being put down. That's kind of the way that I view depression, which is, your emotions are flattened. your behavior is sort of minor, not what you would normally do. Like if you used to be an active person, you used to have a lot of hobbies. When you're depressed, your hobbies sort of fall by the wayside, and you end up not going out and hanging out with your friends and working out or eating right or whatever it is that you used to do. Instead, you sort of fall into a pattern of just sort of doing the bare minimum, right? So for some people in a severe case would be getting out of bed just to go to the bathroom and then going back to bed, and that would be it. And not really being able to function otherwise. And obviously those come with really negative thoughts as well. Thoughts of, how horrible I am as a person and how nothing is sort of okay for me. I don't deserve anything. I have low self-worth, things like that. On the flip side is anxiety. Now, anxiety and depression are related, right? There are sort of like two sides of the same coin. Anxiety has to do with more like worry, though. So anxiety is more like fears. And I like to think of this as sort of like humans have a fight or flight response. Anxiety is if your fight or flight response is always on. You're basically always worried about what could go wrong, what has gone wrong, what could possibly mess you up if you do the thing that you want to do. Like, oh my God, I want to go into med school, but I probably won't do it. So how should I study for the MCAT? Okay, I'm going to study for the MCAT today, but no, I can't do it. I'll study for tomorrow, or I'll study the next day, or I'll study the next day. And then you find out that you've actually suffered before you've actually gotten to the thing that you were worried about, right? You end up facing all of this emotional baggage before you get to the actual issue that you're facing. So yeah, that's basically depression and anxiety. And again, they tend to act hand in hand. So usually if someone has anxiety, they will also have symptoms of depression, and vice versa as well. So if you have symptoms of depression, you may have symptoms of anxiety at the same time.
How can you tell the difference between
going through? Your question?
Yeah, perfect. But how can you tell the difference between a prolonged period of sadness, maybe a day or 2 days, between that and developing depression, or someone saying I'm depressed?
Yeah, that's a good point. So the reality is that all people have emotions, right? Like emotion is a fundamental part of human existence. And, you're going to be sad. That's the reality of life. You're going to be sad. You're going to be happy. You're going to be afraid. All of these emotions serve important purposes, right? Actually, one of the first people to ever write about depression or sorrow was actually Al-Kindi, who's a Muslim scholar. And what he wrote is, if you're trying to avoid sorrow, that's basically trying to avoid being human, right? You can't avoid sorrow altogether. So there are going to be things that you get sad about. And the reality is you need sadness, because sadness tells you that, a certain thing that you wanted was important to you. Some people get sad after the marriage falls apart. If you weren't sad, that would be abnormal, right? The sadness is important because the sadness tells you, well, my marriage was important to me. It's something that I actually wanted to keep, and it fell apart. So now it's something that's going to sit with me. When sadness becomes pathological, when it becomes a disorder, that's when it's been persistent and it's sort of characterized by behaviors that are really ineffective. So typically with a clinical diagnosis, you're looking at persistent sadness, persistent sort of symptoms of sadness, of depression for about 2 weeks, every day, most of the time. Okay, so, if you say fail your math exam and for the next 2 days, you're just a little bit down, or even if you're really down, right? Like you're really annoyed with yourself, you're really frustrated, you find yourself unable to get out of bed, that's probably normal sadness. And that's okay, as long as you can get out of bed and eventually move on. But if you're finding yourself, unable to maintain social relationships, not calling your friends, not calling your family, and, staying in bed, staying indoors, parked in front of the TV most days, then you're probably looking towards more depression-like symptoms, and you probably want to get some help.
When we think about the Muslims, some people think Muslims don't suffer from mental health, or good Muslims, let's put it like that, who are close to Allah, don't suffer from mental health. Is being a good Muslim and mental health mutually exclusive with one another?
Yeah, that's a really good point, and it's one that I've heard many times in the community. Every time I give a talk, actually, someone brings that point up. And I used to try to argue with people about this to try to get across the idea that no, of course not, right? Like, of course, being a good Muslim doesn't mean that you're not going to struggle with mental health problems. And actually, Dr. Rani Awad, who I work with, makes this point very clearly, that in fact, even the Prophet faced sadness, excessive sadness for long periods of time. When the prophets, went through the year of sorrow where a bunch of his loved ones passed away, that's 1 year of prolonged sadness. And the prophet is the person who sort of amplifies or sort of represents Islam, right? You can't find a better Muslim than the prophet, right? And he suffered with these emotional problems, right? That just goes to show you that these emotional challenges, they're out there, and it's not a matter of your faith, right? That you will face these emotional problems. In fact, I think in some cases, I've worked with people who have fallen into some hard times despite having the best faith. They have like unwavering faith in God. They have unwavering faith in Islamic practices. They pray 5 times a day, all that stuff. And some of their challenges, their compulsions in the case of OCD, is that their belief is, I'm impure, I can never go to Jannah even if I practice all these. And so they would practice their religion impulsively and obsessively, right, to the point where they were praying more tahajjud than anyone I've ever met, and they were reciting Quran more than anyone that I'd ever met. And that in fact is actually a mental health problem too. So the understanding should be that it's an emotional problem. Muslims are humans, right? We're not special in the sense of transcending humanity. We stay humans, and part of being human is struggling with your emotional challenges. Now, it is also true that Islam has a lot of great tools, right? Islam has a lot of great tools, and in fact, there are ways to utilize Islam therapeutically, right? So I know, for example, that folks out of the Khalil Center in the States are developing or have developed a therapy that uses Islam or integrates traditional Islamic principles into the therapy, and that's all well and good, and that's perfect for utilizing it with Muslims. But again, it requires sort of special like walkthrough. You need someone to walk you through these issues, especially because the thing about mental health problems is that they change the way you think, right? They change the way you feel. So you can't always rely on yourself thinking straight to sort of practice the religion in a way that will get you out of that emotional difficulty, if that makes sense to you.
Yeah, perfect. Again, I know this is a broad question within psychology, and it comes down to, I think it's nature, nurture, and whatnot. But taking environment out of the equation, is like whether you're Muslim, non-Muslim, or what environment you brought up in, can these conditions like depression, anxiety, can they be hereditary, passed down from?
Yeah, the reality is you can't take nature, nurture, you can't separate them, right? Like you can't take hereditary and environment out. And the best way that was explained to me when I was doing my undergraduate studies by a professor, we studied sort of evolutionary psychology, it was called. And one of the best explanations about this nature nurture debate was, first of all, he started off by saying this debate should be dead. We shouldn't be having this debate anymore. And the reason for that is sort of think of it as this way, okay? Imagine you have a rectangle, right? And on the rectangle, the length is, the area is found out by the length and the width, right? So if I asked you, well, how much of the area of that rectangle is determined by the width? What would you say?
How much of the rectangle? You wouldn't know, would you?
How much of the area of the rectangle
is determined by the width?
Exactly.
You wouldn't know, yeah.
In fact, the question doesn't make sense,
yeah.
right? Because the reality is the width is exactly.
Yeah.
The width depends on the length, or the area depends on the width and the length together.
Yeah.
And that's the same way with mental health difficulties. There are certain elements that predispose people environment, or from a hereditary perspective. There are genetic factors at play. There are factors with epigenetics. There's sort of new theories coming out about that every single day. but it's also related to the factor of your environment and how you were brought up. So you'll know for a fact that some people are brought up in pristine environments and they still end up with mental health problems, and some people are brought up in horrible environments and they never ever develop a mental health problem. In fact, they go on to flourish in their lives. So again, it's sort of a mixed bag. So you'll tend to find both things are at play.
Would you say you're more prone, going back to the Muslim scenario, would you say you're more prone as a Muslim, or cultural background, moving into a Western society and facing Western issues when you're from a different culture, let's say? Would you say you're more prone to developing these conditions, or is it due to a lack of treatment for these conditions from a cultural perspective?
Yeah, one of the challenges is that we don't really know. That's the difficulty right now. Is the research on Muslims living in the West is really poor, and that may be due to multiple reasons. There are some folks say that basically Muslims don't engage in psychological research because they don't trust the research, and so we can't really get accurate data. Some folks say that people haven't been interested enough to look at Muslims yet, and so that we don't get accurate data as well. That being said, some of the research that's being done, and actually some of the research that I've done with Canadian Muslims, for example, shows that Canadian Muslims may actually be up to 3 times as likely as the general population to have mental health problems. So that's a substantial proportion of the population facing difficulties, and it's not exactly clear why that is. So we know, for example, that immigrants and Muslim immigrants and refugees, for example, have more of what's called adjustment disorders. And those are sort of disorders that are related to when you move, how easily is it for you to sort of go back to the norm or to your baseline. And for a lot of immigrants, it's not that easy. And Muslims tend to make up immigrants in most of those countries. So it's not exactly clear whether Muslims face more or less mental health problems. My bet, actually, if I had to put the money on it, is that it would be more. And there are multiple reasons why, right? So one of the reasons is the act of actual immigration, right? That is really stressful. And it comes with a whole host of burdens. So things like when you move into a new country, all of a sudden you may not be able to practice your field. So a lot of doctors, for example, have come to Canada from countries like Pakistan or India or elsewhere in the Muslim world, and they don't meet the equivalency standards. So whereas they were in their countries, in their home countries, they were used to sort of a higher standard of living. All of a sudden they become taxi drivers and they become janitors or factory laborers, and all of a sudden their standard of living drops pretty dramatically, and that can that jarring difference can lead to psychological problems. There's also, of course, and I'm sure we'll talk about this a little bit later, but there's issues related to Islamophobia that lead to problems as well. And of course, Muslims are the only groups in the Western countries that are facing Islamophobia. Other groups, of course, face their own different types of phobias. But Islamophobia is really interesting because it's one of the only phobias or the only types of hate crimes that have been increasing in recent years. So I know, for example, in Canada and the US, except for the last year or so, hate crimes have gone down against Muslims, but generally speaking, hate crimes have been trending upwards pretty dramatically, to the point where in the US right now, there are more hate crimes against Muslims than there were right after 9/11.
Oh, it's a shocking stat, right?
Mm-hmm. And so Islamophobia doesn't leave you unscathed, right? So actually, if you think about the numbers, and I don't know the numbers for the UK off the top of my head, but I imagine they're probably a little bit similar. It may be a little bit different because the UK has a larger proportion of Muslims than either the US or Canada. But in Canada, for example, 1 in 3 Muslims have said that they faced some form of discrimination. In the US, that number is about 50%. 50% of Muslims have said that they face some form of Islamophobia. And if they are, for example, women who wear the hijab or men who have a longer beard and wear a kufi or something like that, or they're identifiable as Muslims, that number jumps up to 75% of those people have actually said that they've witnessed or experienced some form of direct Islamophobia or racism or any form of religious discrimination. And what that kind of discrimination does is it tells you as a person, you don't actually belong here. And we'll talk about suicide, I'm sure, in a little bit as well. And that can have really drastic implications on suicide, as well as other mental health problems more generally.
Would you say, even if whether you face it directly, you face it indirectly, if you're seeing Islamophobia pictured on the news or you're hearing these stats about it, as a Muslim, you're bound to feel some sort of way. So could that have a secondary sort of, I don't want to call it secondary impact, but you're not directly impacted, but you're still seeing it?
Yeah. It's less the direct impact of, or even the secondary impact of seeing Islamophobia. I think most people are resilient. So like, if you've been like, I don't know, if someone yelled at you randomly at a boss, like your boss yelled at you or something like that, most people can like, it'll upset you, but then you can move on, right? But there's a specific message that comes with Islamophobia. There's a specific message that comes with any sort of hate speech, right? And that message is, you don't belong with me, right? That message is, you don't belong here. You're not inclusive. You're not included in my group, okay? And that makes you less. That makes you inferior. Now, for a lot of people, they can bounce back from that, right? Like, so let's say you're someone who has a really strong connection to Islam, and you're someone who has a really strong connection to your homeland. That may or may not affect you as much. You may just say like, okay, sure, I'm not part of you. I'm actually a Muslim. I belong with the Muslim community. I don't belong with your community. And for someone like that, it can bounce off, and they don't really feel much, any type of weight of that. But when it comes to someone who, let's say, was born in the UK, and they're now being told by someone who, looks the part of someone who's been born in the UK, a white man or a white woman, and they insult you, they tell you, you don't belong here. You can question that. That can actually go right to your identity and make you wonder like, oh, you know what? I'm actually brown skinned, or I'm black skinned. Do I belong here? Do I belong amongst these people? Am I actually, who am I? Where do I belong? Who are my people? And that can lead to sort of a drastic sense of identity crisis. And in fact, if we transition just to talking about suicide for a second, one of the main theories of suicide it's called the interpersonal theory, and basically says that the main factors that drive people to suicide are, feeling like you're a burden on other people and feeling like you don't belong. So if, for example, you are hearing a message constantly in the news, in the media, in social media, from random people on the streets, even from your friends as a joke, making fun of your religiosity or making fun of, your skin tone, right? The implicit message that's sent to people is, you don't belong. And what we might imagine is that we'd see an increase in suicide rates among those people. Now, unfortunately, there aren't a lot of data to support this. There aren't a lot of data looking at suicide among Muslims, but actually at the Stanford Muslim Mental Health Lab right now, we're working on that. We're working on some of the suicide rates, and our preliminary data within the Muslim community in the States actually is starting to show that actually Muslims may be at higher risk for suicide in America than they are, than other populations are. And that is a phenomenally interesting study, because the world over, Muslims have lower suicide rates. So whenever you look at the Middle East, when you look at other countries, when you compare Muslims and non-Muslims, Muslims tend to have lower suicide rates. But that being said, when we're seeing a spike in suicide rates or a spike in comparison to other groups, that is really, really, really terrifying, because that means something is going wrong for the specific group. And I imagine the same would be the case for, Canadian Muslims, as well as maybe Australian Muslims and Muslims in the UK, anyone who's from sort of like the Western countries, who may be facing or feeling like they don't belong. So in essence, that's a really long-winded answer to the question of whether Muslims, can be at risk, whether, facing or being a minority group puts you at risk for mental health problems. And the reality is, the answer is kind of maybe.
Yeah.
Because there is something else to be said here as well. So one of the interesting things about a lot of minority groups is that when they come to a different country, they tend to collectivize, they tend to congregate together. And that can be really protective as well. So especially within Muslim cultures, Muslims tend to be folks who come from collectivistic cultures like, Pakistan and India, Somalia, all these places where, the family is really the center of the community. And so they tend to have tight-knit bonds with them, not just themselves, but the families around them. And that can be really, really beneficial. It gives you a social buffer, and that can really be beneficial to improving your mental health, right? You know, you can't stay in bed all day if your friends keep coming over and dragging you out of bed, right? So that can actually be something that improves mental health as well.
We were talking before, you mentioned it before, about a spike in a certain age group or whatnot of this within Muslims of suicide rates and stuff. Again, I'm guessing with the age demographic there, but would you say now within social pressures and with social media and having access to all this online and being constantly connected to people or what's out there, does that have a direct impact on the rates that you were talking about, or?
Within the Muslim communities, for specifically, it's not clear. There's very little data that actually delineates that. You know, what is clear actually though is that in other populations, it's actually the older folks who are at risk for suicide. So it tends to be older white men who are at risk for suicide. That being said, within the Muslim community, I think that demographic is a little bit different. I think off the top of my head, it would be a lower age group who are making attempts on their lives. And that I think has to do with sort of pressures in school, but I'm not really so sure about the social media effects.
What treatment is there out there? If we go into treatment now, what treatment is there out there for people? If we talk about depression, anxiety, again, I'm guessing the method of finding the treatment is the same all across the board, but what is there out there for people? And if you could just give like a sort of a scenario, like if I wanted to go out there and find somebody, how would I do that?
Yeah, I mean, it'll probably change from depending on which country you're in. So I can't really speak to the UK specific methods. What I can say is that there are different professions who are able to help, right? So when it comes to the medical profession, there are psychiatrists. So you can go to, I'm sure, a hospital or a psychiatrist in the community. And let them know your symptoms, and they'll typically treat your problems with either some form of therapy, like an actual talk therapy, or medication, or maybe in conjunction with both. In sort of a non-medical route, more of a psychological route, is going to a clinical psychologist. And clinical psychologists are folks like myself. You know, we're trained at the PhD level, like the doctorate level. So I'm almost there. I've almost got my PhD now, and then I can be called a clinical psychologist or a licensed clinical psychologist. And we would tend to treat people using, again, similar psychotherapy methods. So it would be methodology that tends to be talk therapy. And there's sort of a wide range in between what kind of therapy you can do it. Now, and beyond a psychiatrist and a psychologist or clinical psychologist, there are a host of other professions. And it depends which country you're in and what is a protected term. But in different countries, they may be called counselors, they may be called social workers or clinical social workers, psychotherapists, things like that. You know, in Canada and sort of some other areas, those terms aren't necessarily protected. So really anyone who has like a degree or a diploma in social work or has gone through a couple of courses can actually license or call themselves a psychotherapist and join a college like psychotherapy or something like that, which is not to say that they're not adequate professionals. In a lot of cases, they are very good professionals as well, right?
So we were talking about therapy and receiving therapy and stuff. And I remember watching a program. Have you seen Suits?
Oh, of course.
Yeah, so within Suits, it just came to my mind because I was thinking about a therapist and what it looks like and all the rest of it. And within there, obviously within a high pressured environment and the work that they have, they're all provided with these therapists and stuff. And in that, you see them on a day-to-day basis or on a weekly. The first thing they do whenever the problem, straight away they call the therapist or they go and see the therapist and they sit there and they just vent. So, and the therapist doesn't really say much. He's just listening. So how important is it for someone to just talk to anyone and just vent off their chest? Is that a form of therapy in a sense?
Yeah. You know, definitely family and friends are a good source of support. You know, there's no question about that. In fact, most people tend to go to family and friends before they go to seek services. The difference is, you know, I haven't seen a TV representation of therapy that's good so far. And the reason for that is therapy is really hard to show in a TV show, right? And the reason for that is TV shows are really interested in character development. And so everyone who's on the screen has to have some character development, including the therapist. But usually, the real difference with therapy is that it is unlike any relationship you will ever have in real life, right? Because in every real life relationship, it's two-sided. It's always, like you talk and then your friend talks. So you'll share a problem and then your friend will share a problem. With therapy, the focus is almost drastically different because it's the only relationship where it's socially acceptable for you to be the center of focus. And if you're in a good therapy environment, for example, your therapist won't be talking about themselves, right? They won't be hashing out their own problems, hopefully, right? Ideally, you'll be hashing out your own problems, and the degree of focus will allow therapists to see things that your friends maybe won't be able to. And also there's a certain license you give a therapist, right? Like as an individual coming to a therapist, that you're allowing them to say basically whatever they whatever they see. I can't do therapy with my wife, for example, right? If I started talking to my wife the way that I talk to my clients, we would get into a fight like that. Right? Because there's a degree of vulnerability that you have to have with your therapist that you wouldn't have in other relationships, which is strange to say because of course you want to be vulnerable with your spouses and your friends and things like that, but you can't be fully vulnerable in that way. You know what I mean? It's a very, very, very special relationship. It's actually, and it's hard to express unless you've actually gone to therapy yourself or you've known someone who goes to therapy. Because what my old mentor used to say is the skills of therapy is a transformative power of connection. That's what it is being so well known or being so well understood by someone, and that you really develop an understanding of yourself through them, through their words, and through sort of the insights that they provide. So really, therapy is really, really different from friendship, which again is not to say that friends shouldn't help one another and friends shouldn't talk to one another. That's absolutely the case. And you should absolutely talk to your friends and be open with your friends and be vulnerable and as well as, receive them. If someone comes to talk to you, receive them with empathy and be kind and be warm and be gentle and generous with your time. But if there's a problem that's sort of beyond your understanding, something that you don't really know how to deal with, absolutely at that point, it's time to go to help with a therapist or someone like that. Because, if you have severe depression, one of the things that happens with depression and a lot of mental health problems is your relationships suffer. Right. And that's because folks may be feeling bitter and angry and they'll just lash out. As a therapist, we're trained to take that, right? Like if someone lashes out at me, I can wash it off like sort of like, okay, I understand this is a mental health concern. But your friends probably aren't going to be as forgiving, and it could damage a lot of your relationships. And in fact, it does usually.
When should you talk about the treatment? When should you seek treatment, as in the severity of it? Does it have to be extremely far for you to then want to see a therapist? Even if you start to slightly feel symptoms, can you go and see a therapist? What's the process?
Realistically, I think it depends. It depends on who you're going to. Really, you can go to see a therapist whenever you feel like it. Like anytime that you're thinking, should I go to see a therapist? It's probably a good time to go see a therapist. If you're concerned that your health is deteriorating, it's a good time to see a therapist. There's no hard and fast rule otherwise. What I would say is absolutely do not wait until your symptoms get too severe. If your symptoms get too severe, it just takes that much more work, even when you're working with a therapist, to resolve it. Usually I would say, if you feel like there's something that has been eating you up, like there's a thought that's going on that you just can't shake, or there's an emotion that you can't shake, or there's like a feeling that's been persisting for a while, go seek some help. I mean, especially if you have insurance or something like that will, or your healthcare is covered by either your country or wherever, I would say go seek the treatment because it's better safe, right? Like the worst comes to worst, the psychologist is going to give you a once over, the psychiatrist is going to give you a once over and say, okay, we can go on with a course of treatment that's like a couple of weeks long. I can give you a prescription for medication, or, in some cases, like, I don't think that you need severe issues for mental health problems, and we can still talk, but you wouldn't be diagnosed with anything. So you can still seek the treatment without a diagnosis, if that makes sense.
As a Muslim, is it better to see a Muslim therapist? I know before, right at the beginning when you were talking about imams, and at the time when you were growing up, you were seeing them and they weren't sort of experienced to deal with these larger issues. Personally, I would see imams not being able to deal with this, not as an issue in itself, but as a minor issue within the community. More so because even in the run up to, we've got mental health campaigns starting within this society for 2 weeks, and we're trying to get events sorted. And within a couple of our panels that we was gonna put out there, we wanted some imams on there to give the spiritual aspect of mental health and what they steps people can take. And the lack of imams that we could find that were willing and comfortable to comfortably talk about it and confidently talk about mental health, it was sort of, it set me back a little bit, and it made me want to do this even more so people can sort of then seek different avenues of help. But for me, it was a bit shocking to see the lack of faith leaders who were comfortable to talk about it. What's your take on that?
There was a study, not actually, it's quite a long time ago now. It was post 9/11, right after 9/11, out of the States, and it basically said that imams were the leaders of mental health work. Like they were the people that Muslims went to go to mental health problems. And nowadays, actually, that's changing. So I've got a study that's under review, inshallah, will be published soon, that actually shows that for Muslims, that tide is, at least Canadian Muslims, that tide is shifted. People don't want to seek services from imams anymore. And that may be for multiple reasons, right? So it may be out of fear of judgment, worried that their imam might say something, or make them feel like a bad Muslim or something like that. It may be out of worries that, going to the masjid and seeking services isn't exactly confidential. Like people can see you going into the imam's office, especially if they're at the masjid. And so there's a fear that, someone will know my business. Also the fear that what if the imam slips and says my name out loud to people that I know? And I've heard all those fears from the community members. So that's not to say that imams don't have a role. Imams have a very important role. They have a role in sort of addressing the community. So in one of the things that we're doing these days is developing a suicide toolkit at the Stanford lab that Dr. Rania leads. And one of the roles that we have is sort of the khutbah. If in the event of a suicide, the imam has to make a khutbah to the community. That's an important role for the imam. That's a role that I probably wouldn't take on as a psychologist, right? To stand up at the minbar on Friday when the entire community is there. I'm not trained for that. So imams definitely have roles when it comes to answering questions of spirituality and religiosity, right? Someone is concerned about marriage and whether, so-and-so is an appropriate spouse based on religious principles. That's a role for an imam, right? If someone is worried about, their afterlife or their akhirah and things like that, and they're not sure about where to get the answers from, that's the role for an imam. Where imams, and there's some studies now that have shown not just imams, but imams and clergy members in Catholic and Christian faith groups, they used to be sort of like the predominant people that people went to for support. But most of them actually feel like they're not qualified to provide mental health support, things like depression and anxiety. And in fact, they would like to refer out to sort of community-based workers like psychologists or psychiatrists.
So would you say then, is it better for like putting the imams to the side now with the issue of them speaking? Is it better for Muslims who are wanting to seek help? Is it better for them to seek help through Muslim therapists?
Yeah, that's a good question. And it's a question that doesn't really have an answer. One of the interesting things about therapy is there are multiple different modes of therapy, right? And a lot of them are evidence-based. In fact, most of them are evidence-based, and all of the evidence-based ones work. And each of those evidence-based therapy styles, the various different styles there are, actually what they say is the most important thing, regardless of the way that we're doing treatment, is your connection with your therapist. So some people will find that they want to go to a Muslim therapist because they feel like a Muslim therapist and only a Muslim therapist will understand their problems, right? So people have come to me, for example, with issues with identity, and issues with fitting in, issues with, all my friends drink and I don't know where that puts me. Or issues with substance use because they don't feel comfortable going to sort of a regular person, because a regular person would say like, oh, you're having one glass of wine a night? That's not a big deal. But for them, as a Muslim, they'll say, I need someone who takes this seriously because it is a problem for my faith. So if that's the place you fall into, where you feel like you need someone from a Muslim background because they'll understand you better, then by all means, go seek a Muslim therapist, like 100%. And usually that'll help. It'll give them a sense of familiarity in shorthand, right? You won't have to describe sort of the Islamic faith to them and also like teach them and hold their hand as you go through it. That being said, if you go to a therapist where you feel safe and adequately open with someone who's not Muslim, and you feel comfortable enough talking about your religious problems and your problems with not fitting in and your not problems with not belonging, that should work as well, right? So again, just as long as there's someone you're comfortable with and someone that you feel completely open talking to. And again, if you feel like they don't understand you fully as a therapist, because they come from a different walk of life or something like that, then by all means explain to them what the issue is. And hopefully, if they're a good therapist, well trained and the like, they should be able to brush aside their assumptions and take you on as a client.
Amazing. How as a society or even an individual on an individual level can we assure the people who need help but don't seek it themselves, because it's not easy again to say that you need help, how can we assure that they get the help that they need?
Yeah, that's a good question. And there's probably multiple different ways you can do that, right? For one, not everyone has access to mental health care, especially if you come from a lower income, and mental health care, if you're going through like a private route, can be pretty expensive. So, if it's possible to give to community charities that are subsidizing the cost, if you can donate to those charities. I know, for example, in Canada, there are masjids have some of the masjids have sort of emergency funds or funds specifically for ensuring people get this mental health services that they can. You should donate to those funds just to help subsidize the cost for people who don't maybe have the funding. Another way that we can do it is through events like these, right? We need to talk more about mental health in our community, which, I mean, and the thing that's so disheartening about that is, for some reason, there is this belief that mental health mental health problems don't mesh well with Islamic worldviews. And that could not be the farthest thing from the truth. Like it could not be further from the truth, because the reality is Muslims were the ones who originated mental health care, right? Like way back when there was like Galen in ancient Greek, and then starting, and he just sort of like touched on mental health issues just very, very, very briefly. But then all of a sudden in the Islamic golden ages, we have people talking about all sorts of mental health, with the first psychiatric hospitals opened up in the Muslim world in Baghdad, right? Treating purely psychological ailments. The four first forms of cognitive behavior therapy, which is like sort of the gold standard today, were developed actually by a student of Al-Kindi, Abu Zayd al-Balkhi, his name is, and he developed the first form of cognitive behavior therapy. And this was, I think, something like a millennia before it was developed here, or more than a millennia before it was developed here. So Muslims actually have a history, not only a history, but we are the pioneers of psychological treatments. And somewhere along the lines, we decided that actually psychological treatment is not our legacy. It's a legacy that belongs to the West, and so it doesn't sort of fit well with ours. When in actuality, it is the legacy that we bring to the table, right? Like it is one of the best legacies that we bring to the table. And a lot of these principles that these mental health, early classic scholars and mental health practitioners derived it from Islamic principles. So actually our faith itself has a very strong, or should have a very strong advocacy for mental health. So we need to bring these conversations to light and recognize actually that Islam is here. It's designed as a way to alleviate mental stress. And actually, if we are facing stress, it is not only within the prophetic example, but it's almost compulsory on us to ensure that everyone else around us gets the treatment. And it's also compulsory on us to seek the treatment when we have an issue, because if you have an issue, you can't take care of your family, you can't take care of your friends, right? So you need to resolve your health so you can take care of the others in your community. And then the last thing, this is from more of an individual perspective. The more and more I do research on this issue of stigma within the Muslim community, the more I'm coming across this interesting finding. And the interesting finding is that people are concerned about stigma. Everyone at the individual level is concerned what other people will think. But when you ask them what you would think if someone else was seeking services, most people will say, no, I wouldn't think anything of it. I would think it's good that they're seeking services. I think it's helpful that they're seeking treatment. So we have all this compassion for other people. And as a community, I actually think that this compassion is within the community. so that if you were actually seeking services, no one would think of you poorly. But for some reason, as individuals, we have that mindset that if we do seek services, our community will see us poorly and will reflect poorly upon us. And so we hide it and we refuse to go seek treatment. So if we bring that to light, that actually our community is supportive and they would have your back if you're seeking services, I think more people would be likely to seek services when they needed it.
Would you say, before even getting to the part of accepting, people are saying the stigma behind accepting help and all the rest of it, accepting mental health as an issue within the Muslim, or again, there's a big grey area between the Muslim and culture aspects of things? Because I've had numerous conversations this year, and I've been approached by numerous people asking about black magic and all the rest of what goes on with that. And I understand, obviously, that's a real issue as well. But the 9 times out of 10, when people ask me them questions or they want me to follow on with somebody else, I can guess why they're asking, because there's something going on up there, and the first thing they turn to is that. So what's the rationale, in a sense, with that, and the problem with accepting health and mental health as a real life issue?
Yeah, I mean, there are a lot of people who view mental health problems as starting off with black magic and the evil eye and things like that. And Allahu alam, right? Like, of course, in Islam we accept these as things that can happen. But I also think when there are other answers out there, seek those other answers. And what's interesting as well is actually just today I was reading a book called Majnoon. It's sort of a documentation of mental health problems within Islamic society. And the classical understanding was very, very few people talked about sort of the madman as someone being afflicted by black magic and things like that. They understood it. There was some concern that it might be jinn, and there was some concern that it might be other things like that. But they understood it as a treatment or something that needed treatment. And so within the Muslim society, there was this element of compassion. Even in the early days of the Prophet, there was this understanding of compassion. When someone has struggled with mental health problems or is struggling with mental health problems, speak to them softly, speak to them warmly, give them gentle compassion, make sure they get their food, make sure they get their sleep, make sure they have a home to live in, things like that. So, whether it is black magic or whether it's, something else, to me, it doesn't seem like there's much of a difference. I would say take the simpler answer. The simpler answer in these cases being, when it comes to things like depression, anxiety, and things like that, we have reason to believe that they are both biological and environmental. And if you can address them with biological, environmental, scientific back methods, do it. And I mean, like that's the whole point of treatments, right? I mean, in the past, people also believe that like issues with like physical ailments had to do with shaitan and things like that, and then they would make dua and stuff, but that didn't stop the Prophet from recommending things like black seed and other Galenic medicines at the time, right? Because that was sort of the scientific methodology or the scientific understanding of healthcare at that time. So, it's a prophetic example to seek treatment when you're afflicted with some sort of healthcare problem. And I think that's at the end of the day what we should do.
Definitely. Again, time is of the. I don't want to take too much of your time up. I'm sure you're a busy man, rather than sit here talking to us. But when it comes to, again, with mental health issues, we can sit here and talk all night, as you can imagine. So with you studying it and stuff, we'll quickly touch on suicide now. Again, it's a sensitive issue and stuff, but when it comes to suicide within Islam and all the rest of it, it's not enough anymore, I don't think, just to tell someone who's experiencing these issues or thinking about taking that next step further, to tell them that suicide is haram. What would you say is, I want to say the best way, because obviously it's a lengthy process, but what is the alternative to that?
Yeah, so inshallah, we're going to be publishing a paper on this topic very shortly, on suicide and the ethics of suicide from an Islamic perspective. And there are a couple of important things to note, right? So Islam has very strict rules against suicide, and that's important. Having those strict rules, some of the research shows actually that having strict rules against suicide is really protective of suicide. So when it comes to it, especially from the perspective of community leaders and imams and things like that, it should be frequently pointed out again and again, right, that suicide is not permissible within Islam. And there are numerous people who do not act on suicidal urges and intentions, because they have that mentality that, I may want to die, I may want to end my life now, but I'm not going to do it. because if I do, I'm going to go to Jahannam, right? So it is actually a very preventative measure. That being said, most people who are acting in sort of suicide, or who are in a state of suicide ideation, or are seriously thinking about killing themselves, can actually, some people can take that the wrong way. So, some people will feel very negatively toward themselves, and they'll believe that they're going to hell anyways, so might as well hurry it up. And that's also not the right way to look at things. So the way that we should understand the Islamic injunctions on suicide is that it should be Islam should be a very hopeful message, right? If someone tells you that they're going to kill themselves, and they're telling you that it's imminent, you have reason to believe that they're going to do it right away. Sit with them, stay with them, do not let them out of your sight. Make sure that they're calm, but also make sure that they get the treatment. So if someone is telling you that they're at risk for suicide, immediately take them to the hospital, right? Immediately take them to the emergency room, urgent care. And it doesn't really matter if someone is telling you, like, I'm going to be really offended by this. This is not something that you hide. This is not something that you keep away because you're holding your friend's secret. This is something that you break that secret. You break that trust in the situation where you have reason to believe that someone is going to hurt themselves. It's actually your imperative, your Islamic imperative, to break that trust, because the value and the sanctity of life is more important than anything else. Okay, so you get them to the ER, you tell their parents, you talk to their family or whoever to make sure that they get the support that they need. That's the first thing. The second thing, again, is for the community members to recognize, I think, after a suicide happens is one of those times where things are really sensitive. And after a suicide happens, it's not up to the Muslim community to be judgmental. And it's not up to the Muslim community to question whether someone is going to heaven or hell. It's not within our rights. In fact, the opposite should happen. What should happen is you go to comfort the family. You should make dua for the person who has lost their life, right? And inshallah, we'll be publishing some guidelines on this soon as well. But that's sort of the general understanding of these things. There's a hadith that says that before someone commits a sin, make it as, actually, I don't think it's a hadith. I think this is a saying of, I believe it's Ibn Abbas. Before someone commits a sin, make it as heinous as possible. Paint it in the worst light that you possibly can, right? But after they've committed a sin, open the door to mercy. So it's basically shut the door in their face before they're about to do it. And if they have done it, open the door to mercy, okay? So, when someone is feeling suicidal, share with them that merciful message that anything that they've done wrong, they can be forgiven for. Anything that's going wrong in their life, they can seek treatment for. They can improve it. And then, of course, make sure that they get the treatment that they need.
When you mentioned earlier on, again, about the men, you said a factor, again, apologies, I didn't write that down, but you said that men are more like they're within the highest factors of committing suicide. Why is that? Why is it not?
That's actually white men. The reality is, within different communities that differs. And I think the findings are actually showing that women in our communities are more likely to take their own lives. And some of that has to do, some people have said that it has to do with patriarchy issues. It has to do with issues related to, the treatment of women. And there are some cultures that really push for honor before anything else. So in the UK, actually, I was reading a study about this not too long ago. And this was a study about basically Muslim Pakistani women in the UK. And so many of them reported that it's more sort of acceptable to harm yourself than it is to go seek treatment. So they reported that it's an effective way of coping to hurt yourself rather than get treatment. And I mean, we have to think about that as a community. Like, that's a failure as a community. If people in our community believe that it's okay to hurt yourself rather than get help, then we as a community have to take a good hard look at where we are and what we've done to allow this to happen. And we need to open those doors back up for treatment, right? Because again, there's no shame in treatment, right? As much shame in treatment as there is in talking to your friends, right? Like, that's, at the end of the day, finding a way to be healthy. There's nothing to be ashamed of on that front. So, and with regard to women, especially when it comes to suicide and suicide risk, generally speaking, and again, there's very little research on Muslims in that front, but there's still reason to suspect that men may actually end up taking their lives more, but women may actually attempt to take their lives more. Does that make sense? So
Yeah, yeah.
there's this paradox. It's called the suicide gender paradox, which is to say that women tend to harm themselves more, but men tend to use more lethal means, and so they end up dying at a disproportionately higher rate. It's not clear whether that's the case among Muslims, and it seems to be the opposite.
I remember hearing a story about someone who approached the parents, and they were saying, they was explaining basically about them feeling a bit under the weather. Again, they didn't go as far as to do the acts itself, but they were talking about it with other people. But when they approached the parents to say they was experiencing something, they basically got laughed away because the parents are from a cultural background. They're first generation into the UK, and they were basically saying to the person or their son that, what are you experiencing? Like, we've been through so much more. We emigrated here. We've been through this, and what you lot have got, you're born with a silver spoon. So is that an issue within itself? Someone is experiencing these, but when they approach their parents, they can't sort of deal with it at home because of the reasons that stated.
Yeah, that's a big issue. Actually, in sort of response to that as well, I should make it clear that if you are concerned that someone is having suicidal thoughts and ideations and things like that, it is perfectly acceptable, and in fact, I think imperative that you ask. Right? People often have this assumption that if you ask someone if they're thinking about killing themselves, that might put an idea into the person's head. That's actually not true, and the research shows that that's not true. It's in fact, it could be life-saving to ask someone, are you're not feeling so, like, have you been hurting yourself? Do you ever think about killing yourself? And ask that with compassion, and ask it straightforward. And if they say yes, then because the likelihood is people aren't going to bring it up themselves, because a lot of people feel ashamed to put that, so they're probably not going to bring it up themselves. But if you ask, it opens the door to let them talk about it. So if you are concerned about someone's emotional well-being, it's perfectly well within your rights, and I think well within the sort of acceptable recourse to actually ask. When it comes to parents and their children, one thing that should be clear, I think, to parents and to children, is that from what I've heard in our community, there is a gap in understanding. People, like parents and their children in the Muslim community, have difficulties understanding each other. And inshallah, I'm publishing a book on this soon, that sort of goes over the different difficulties of parents and of different difficulties in children. So inshallah, keep your eyes posted for that. But the gist of it is that parents did go through financial struggles. Our parents tended to take on low-paying jobs and live in sort of squalor for many, many years to give us a financial circumstance as it is now. So what they didn't have, in terms of the differences between us and them, is we don't have the financial burdens that they did. So we don't have the same financial stressors that they did, to some extent. To another extent, there are other financial burdens now, right? Like, housing prices all over the world are skyrocketing, and it's harder to find jobs and things like that. So there are those financial burdens as well in this generation. But on the flip side, parents tended to come, our parents tended to come with a sort of an identity that was more well crafted. So they tended to come from communities where they left when they were adults, right? So they were basically able to fit in, and when they came here with their culture intact. And so they practiced their culture and they accepted it. We, on the other hand, our generation, on the other hand, is born at the intersection of two cultures. And so as parents, we need to understand, our parents need to understand that as well. And the parents in the community need to understand that your children are not just facing, it's not just about the economic burdens. There is a social burden that, they have to figure out whether they belong with their friends that are non-Muslim, whether they belong with their friends that are Muslim, whether they belong with their parents' culture that is, Muslim but not British, or whether they belong in the UK culture. And that can be really, really complicated. It can be very, very complex for people because, for example, if your friends are going down to the pub and you're just like, I can't go to the pub because, they serve alcohol there, all of a sudden you're excluded, right? But then if you do go to the pub, and even if you don't drink, or if you do drink, all of a sudden you feel guilt and shame that, oh God, I've done something wrong. So it's in a way, in the social circle, there's sacrifices that this generation has to make that our parents didn't have to make. And that can be really detrimental to mental health. So there needs to be some more intergenerational dialogue, I think, for sure, where, we understand the struggles of our parents, and we respect them for it, and we show them compassion and show them gratitude. And then on the parents' end as well, there needs to be sort of a recognition that our kids are struggling, and they're struggling every single day with complex issues of morality and issues of identity that maybe they didn't go through themselves. So of course, they should recognize that there are challenges there.
I think it's a constant learning curve for both parties, I guess. Again, that's all from me, based on the mental health struggle and suicide. I think this is a good point to say that if anybody does experience any of these issues that are listening, as a society, we have our own counselling in-house Muslim chaplain, Muhammad Allah, with the university, and obviously you can contact people like Bilazia and anybody else to help you through your struggles and direct you in the right place. Just before you go, I'm going to ask this to everybody we have on here. Is there two tips that you can give to students at the moment to maintain a good mental well-being during coronavirus?
Oh, that's a good question.
No, sorry, it's a bit of a ball spin. You didn't expect that.
No, it's a good question. In terms of two tips, the first one I will say is try to establish a routine. A routine, especially when the world is in such uncertainty. A routine can be your best friend, and it can actually help you keep your mental health intact. And by a routine, I mean, try to wake up at the same time, go to sleep at the same time, try to get some exercise in every single day, get your studies done, and spend some time for leisure activities. Make sure to call a friend or family every once in a while, every day, even if you can, to make sure you get a little bit of socialization as well. That would be tip number one. And I think there was kind of like multiple tips in there as well. And then tip number two.
I can't tell if that was you trying to get away with giving tip number two, or you was.
Yeah, that's me being too talkative, which is something that I've been accused of many times. I'll stick with tip number one. Do tip number one. Let's not overcomplicate it. Build a routine. And I guess tip number two is if you need treatment, give someone a call. There's telehealth services now that you can get treatment pretty easily from the safety of your own home.
Perfect. So that's all from me. I just want to give a big thank you to Bilazia for attending tonight's talk. I mean, I say tonight, here it's 11:30. I'm not sure what time it is there. I'm sure it's like 6:30.
It's 6:30 for me.
Oh, you've got your whole evening.
I've got just about dinner time for me. But also, let me also express my gratitude towards you as well, because I think what you're doing is really, really needed work. And inshallah, we're going to see some much needed benefits in the community of the UK, especially the Muslim students at your university, inshallah, to get them sort of the services they need to help them advocate for themselves a little bit better. So inshallah, if you guys meet Ismail after COVID, give him a pat on the back, inshallah.
A distance pat on the back. Just before you go, I did write it down here. You mentioned you publishing papers. Where can people find these papers if they wish to do so?
Yeah, you can subscribe to or you can follow the Stanford Muslim Mental Health Lab, their Instagram page, and that post, or they'll probably post it once we do publish our papers. In terms of my book, it's coming somewhere down the line, inshallah. We're just about getting figured out with the publisher and all that. So I can't really say where they'll be able to find it, but inshallah, I'm happy to keep you guys posted.
Definitely, inshallah. If you can do, we'll let our listeners know as well, inshallah.
Perfect.
Okay, Jazakallah khair, and once again, Barakallah Feek for attending, and I'm sure people benefit from your knowledge that you've just surpassed people there.
Thanks so much, and Jazakallah for having me.
Inshallah, we'll catch up soon.
Inshallah. Assalamu alaikum.